In this presentation, I'll be discussing Kearns-Sayre Syndrome. So Kearns-Sayre Syndrome is a rare neuromuscular disorder, meaning that it affects both your muscles and your nervous system, and it's caused by abnormalities in the DNA of the mitochondria, specifically a deletion of a large portion of DNA in the mitochondria. And this usually occurs in body cells and is thus a somatic mutation. Symptoms of Kearns-Sayre syndrome include PEO, which is a symptom that progressively limits the patient's ability to move their eye and affects the muscles around the eye. This can also cause the patient's eyelids to droop. Another symptom is heart block, which is abnormal heart rhythm caused by an issue with the electrical signals in the heart. Additionally, there can also be hearing loss or abnormal pigmentation in the retina, which can affect the vision of the patient. As you can see, this syndrome is caused by the deletion of a large portion of mitochondrial DNA, and because this is a random event in the body cells of a person, they can still be affected even though both of the parents do not show any symptoms of this syndrome. Some questions that may be asked about the syndrome are, will the syndrome affect my children? And the answer to that is no. In most cases, this syndrome will not be passed down to the children because it is a random event and thus is not passed down through genetic inheritance. The second question is this condition fatal? This condition can be fatal due to one of the symptoms, which was heart block. This symptom causes death in 20% of patients. However, a pacemaker implantation can also extend your lifespan. The last question is, can Kearns-Sayre syndrome be cured? This syndrome cannot be cured because it's caused by a random event of deletion of mitochondrial DNA, and because that is irreversible, there is no specific cure that can get rid of the syndrome entirely. However, there are management options for the symptoms, such as hearing aids for hearing loss and a pacemaker for heart block or heart issues. Here are some recommendations for someone who has Kearns-Sayre syndrome. The first recommendation is to get hearing and vision checkups regularly. This is because this syndrome can cause sensory neural hearing loss in patients, and getting it checked out can identify whether a patient needs hearing aids. Also, the syndrome can cause vision issues because of the abnormal pigmentation buildup on the retina, which can affect a patient's vision. The second recommendation is to have regular visits to the cardiologist. This is especially important because, as stated before, 20% of patients die from heart block. So it's important to get your heart checked out and to get periodic electrocardiograms to make sure that there are no issues with your heart. The last recommendation is to consider getting an early pacemaker implantation. Because heart block can be fatal, it is important to make sure that your heart is working well. Therefore, getting an early pacemaker implantation can prevent the fatal effects of heart block and can help extend a patient's lifespan.